Week number 4 in Hope Helps, our series on mental health, addictions, and the like. Today we're going to be dealing with self-diagnosing and self-medicating, two pretty significant issues in understanding our mental health and how to treat it. To start off with self-diagnosing, one of the wonderful things about the internet is we can learn a lot of stuff. One of the terrible things about the internet is not all the things that we learn or come across are helpful. When it comes to the world of mental health, there are many well-meaning posts, there are many well-meaning websites that are trying to inform that really have just not done a very good job of teaching us what it means to have a certain issue in our lives, whether that's depression, anxiety, or anything else that we'll be talking about into the future here. Self-diagnosing means diagnosing yourself with a specific condition or a mental disorder without ever actually seeing a professional that's qualified to diagnose you with a certain issue or disorder. This can happen when we're talking to our friends. This can happen when we're browsing the internet. It's kind of like those people who have a pain in their stomach and they go onto WebMD and then they diagnose themselves with cancer when really they just have bad gas. The same type of a thing can happen in the world of mental health, where we feel a certain thing going on in our lives, an emotion or a feeling. We go online, we research it, or we ask a friend about it, and they tell us that we are depressed, or that we have anxiety disorders, or that we are bipolar, or any of the other words that are thrown around so easily these days. And we label ourselves as a certain thing when really we've given no thought to actually seeing a mental health professional, counselor, psychologist who can actually help us figure out if that is even an appropriate label for us. This can do a lot of harm because this can make us dwell on a feeling or an emotion or a phase in our lives more than is helpful. That's not to say tune out your gut feelings, but it is to say, again, go and see somebody, go and see a doctor. Do the blood work if it's necessary. Talk to a counselor. If you think that there is a reason for them to be concerned about your mental health, then it's something worth looking into more than just talking with your friends. Although I'm sure they're very, very well-meaning, they're probably not qualified to diagnose you with schizophrenia or anything like that. Be careful with self-diagnosis. The other side of this is the self-medicating, and this is where it gets really dangerous. When things hurt, when things affect us, when things cause us trouble, again, we go to our friends to help us. We go to the world around us to make us feel better. We can use a lot of things in this world to self-medicate, to try and make us feel better for the moment, that will actually, in the long run, make things worse. When it comes to mental health, medication is not the first thing we should be jumping to. A lot of the things that come up in counseling have to do with talking through the situation, understanding the root of the feelings we're having. What we want to do as human beings is we want something to feel better now. We want something to make us feel better in this moment so that we won't have to feel the sadness, the pain, the anger any longer. And what that can look like is, I'm anxious, I really am nervous, and I have all these terrible feelings of anxiety, so you know what I'm going to do? I'm just going to go smoke a whole bunch of weed because that makes me feel better and I don't feel anxious anymore. That's not actually addressing the anxiety. That's covering it up with a substance that is lying to us about what it can actually do for us. We feel depressed, we feel so heartbroken and hurt and no motivation to do anything, so our friend says, you know what, forget about it. Come out with us for the night. Come drink. Come party, and you'll feel great. You won't be depressed anymore. Again, this is not actually addressing our depression. I would argue that going out and using alcohol will make it worse because alcohol is a depressant, which will probably cause us to feel worse. And even if it makes us feel better for the night, we're not actually addressing the problem. We are going to wake up sober, and we're going to wake up with the same issues we had today. Self-medicating can actually and likely will do a lot more harm in your life than trying to find the real fix for the problem. I don't know what you use to self-medicate. All of us have something that we gravitate towards to make us feel better. All of us have something that we go to when things are tough, when things are scary, when things are hard, to try and fix the problem. I will tell you that nothing we go to will will do anything more than temporarily numb the pain in our lives or numb the issues that we're experiencing. I would challenge you to do the hard work of figuring out why we're feeling the way that we are. If it's a big issue that we don't feel like we can handle, tell somebody. Have somebody walk through this with you. That's what friends are for. That's what parents are for. That's what youth workers are for. That's what doctors and guidance counselors are for. Use the people in your corner, but please, please hear me carefully when I say self-medicating, going to alcohol, drugs, sex, relationships, it's not going to fix the root issue in your life. I don't know what the root issue in your life is right now, but I will tell you this, that you were created to live a healthy life, to be able to use your mind and your body to worship God, the one who made you. If you have questions about how we see God playing into this, we'd love to chat. We do care about you guys, and we want to see you be able to live lives healthy and effective away from the trouble that comes from self-medicating. If you feel like you have some serious issues with your mental health, do the hard work. Talk to somebody about it. Go see a doctor. Go talk to your guidance counselor. Talk to a professional that maybe actually can diagnose if there's a real issue. Again, we don't disbelieve in mental health issues. We would just like to see people handle them the way that's actually going to get them help. Again, if you have questions, leave them in the comments, shoot us a message, check out our blog, subscribe to our channel, and we would love to hear from you guys. Thanks for listening.